Thank you, Councilman Druso, and the rest of the committee. Happy to be here to talk about these funds. What we're talking about today is the Orleans Parish share of Louisiana's opioid settlement funds. And just as a little bit of context, as you know, many states, I don't think it was all 50, but I think it was close, banded together in a series of class action lawsuits against drug makers and who were ultimately found to be held responsible for our significant opioid crisis that, as of last year, killed over 100,000 Americans a year and has risen every year for the last 5 years at pretty astounding rates. Using a formula, Louisiana was awarded close to 340 million, I believe. The state then set up a task force and a 501c3 to administer these funds. The way the settlement rolled out was that each parish was allotted a certain percentage of the overall settlement, and the settlement itself would be dispersed over 18 years, very similar to previous tobacco litigation. Orleans Parish was awarded 6.9% of that settlement solely for our use. It's interesting to note that the amount was based largely, as I understand it, on not only population, but also the need. So there are only a handful of parishes that received more than we did. And that's because, quite frankly, either they're larger and or they have a greater burden of deaths. We've been anxious. We've known about these funds for about the last 6 months or so. And so my office has been preparing for them. Receiving them has taken some time, but I'm happy to say that we have received the first amount. This ordinance would allow us to use it. So the question is, what are we going to do with it? We know that the problem is vast. According to coroner's data, 499 individuals last year died of some kind of overdose. Of those, over 90% included opioids, fentanyl. Now, there may have been other substances mixed in, and there were. But clearly we have a problem that's killing hundreds of our citizens. Every day, the New Orleans Fire Police and EMS, as well as often bystanders, administer life-saving naloxone to victims of overdose. So we know that we are saving a lot of folks, but opioid use disorder and opioid addiction comes up in every community, every neighborhood, every scenario that you can imagine. So this is a broad and pervasive problem. It certainly gets exacerbated, as we talked about yesterday, in our most vulnerable residents, like those who are unhoused. We do see a tremendous amount of opioid use disorder, but it is not exclusive to that community. It touches all of us. So as we've been thinking about the best use of this money, we feel like it is imperative to come up with a strategy that is going to be efficient, effective, and reach as many people as possible, and be broad both in intervention and prevention. So treatment and prevention. Johns Hopkins actually has emerged as the leader in helping cities and states figure out how best to use their settlement funds. And we have been engaging with them and are getting help from them. The state itself, it is very specific as to what you can and cannot use these funds for, and we intend to fully comply with their regulations. Many of the things that are allowed, we're already doing in some form or fashion, which is helpful. But we need to know where the gaps truly are and what is the best use of this money, and how can we then use it to leverage other funding sources to fill the gaps to provide it. So the first thing that we're doing, and actually it's already in process because we just couldn't wait any longer, is an RFP for a comprehensive needs assessment. So bringing in someone who will work with our community, and that's going to be people with lived experience. It's going to be our providers, healthcare professionals, everyone that has a stake in opioid use and the epidemic that it's caused, to help us have a community roadmap and strategy that we can then implement over the next 18 years. We think that's imperative. We do not want to just throw money at this program or that program without having a comprehensive approach, because I think we saw with tobacco that didn't work out very well. there are some things we will likely continue with this funding, even as we wait for the comprehensive needs assessment. One of those is our education, our outreach, and our naloxone distribution. Last year, our office gave over 5,000 doses of naloxone. We partnered with many of our harm reduction partners who are giving out even more. We saw our bystander naloxone administration rates go up really, really fast, and they continue to go up. So we know that equipping citizens with the training and the tools that they need to prevent overdoses buys us a lot of time and truly saves lives. We're going to keep up those education efforts. We've talked to pretty much all of your offices about doing that. So that's one thing that we know is not going to change. And the other thing that I'm really hoping that our needs assessment will help us is a broad communications campaign about opioids, about not only the harms, but also resources, so that no one in this city will say, I don't know where to go for help. We would love to do that in concert with other parishes, because this is not just an Orleans Parish issue. So I'm putting it out there into the public that we would love to work with Jefferson, St. Tammany, St. Bernard, Plaquemines on this. All that to say, we fully understand the urgency of getting this money to where it's needed. We fully understand that we will need to support prevention and treatment, and most significantly, wraparound services for folks who are suffering through addiction and who need help to stay in treatment. So we are excited about the needs assessment. We're excited about seeing some of the initial things we're going to do, and we're just ready to hit the ground running.
Thank you, Dr. Avegno. I guess just very quickly, as we had a long committee meeting yesterday, and seriously, so much of it was wrapped, in my view, not just about affordable housing, but also root causes of issues, whether it's mental health, addiction, other needs. And this is one of the paths forward that the opioid settlement is allowing us to go down. Am I right about that?
Yes, that's correct.
Okay. It looks like, Mr. Burnside, that you have a card, so you'll have 2 minutes before we speak ourselves. I want to also thank you, Dr. Avegno, because you pushed getting this as quickly as possible, and we understand what the needs are. So, Mr. Burnside, the floor is yours for the next 2 minutes, sir.
I learn from Councilman Green whether I like what he teaches or not. So it's important that I thank you, because it's honest. You've done a lot of good work in this city. You have a good reputation, and it is a good thing for the city that you agreed to be employed by it. So thank you. I don't thank people well, and I don't have a lot of skill in it, but try to learn before we die of old age, I guess. Two things. I used to be able to do math in my head, and I still do math in my head, but I don't quite trust myself anymore. So I'm going to phrase this as a question, and it's not completely rhetorical. It seems to me, from what I know about Orleans Parish population, the state of Louisiana population, the amount of opioid overdoses in Orleans Parish versus the average for the state, that 6.9% seems low. So how it was arrived at might be a nice thing to present. The other thing is that way back in the day, I knew a little bit about homelessness in San Francisco. That was when I was like 40, which was 20 years ago. And then they were doing some EMS studies and the number of people using ambulances and these kind of things. So if we're busy preventing overdoses, are we really preventing suicides? Are there certain individuals who are taking, say, more than a dozen doses of Narcan a year?
Thanks. I can speak real quick. I really, the percentages were derived prior to the parishes being informed. I imagine it was as much a legal derivation as it was truly looking at data, but that's what was written into the settlement. So I'm happy to find out more information than that. And then, yes, to your question about are there people requiring multiple doses of Narcan? The answer is unequivocally yes. Are some of our overdoses or attempted overdoses suicide attempts? The answer is likely yes to that as well. This is a complex problem, and so not every user is the same. And so I think it's imperative on us to find solutions that work for a variety of folks who are suffering through addiction.
Thank you. Do we have any online comments? None? Councilmember Green.
Could collection of needles be included in such a grant?
Yes, sir. And yesterday's meeting reinforced, I think, a lot of the things that we've been talking about. It does give us a good opportunity because we do collect some needles. We are working on a system. The problem is not having boxes to put up. The problem is having a company to service them. As it stands now, the only way that we have is to work with EMS's bio waste servicing contract and to physically bring boxes to EMS for their folks to collect. That is not ideal because that requires someone to go around. If we put up 50 boxes, then we have to have someone to go who's specially trained with all the equipment to do that. That's been the sticking point with the needle collection. And that's something that we've been working on. We are going to redouble our efforts to just come up with a solution. So it's not so much a money issue, although I do anticipate that some of the money that we're getting could be used for needle related activities. It is that finding someone to dispose of them, there really are very few solutions. And that's not just a New Orleans problem, it's a national problem in terms of how to get them safely disposed of. But yes, that is part of the allowable activities, and I imagine it'll be part of our scope.
Is that something that the health department can do itself, or there are firms who have special licensing that
So it's best done by companies that are specially trained and equipped to do that. Certainly that's out of the scope of what we have now. And those firms are limited, but I think we just have to figure out a path. And even if we start small, at least test it, make sure if it works, then we can figure out how to expand it.
And it's going to be obvious what I'm saying. You know, I'm concerned, as everybody else is. But when I hear that Jordan is picking up needles, Taylor is picking up needles.
Right.
I just want this money to be part of us finding a way. There are hundreds of needles on Claiborne Avenue and on some of the playground areas. You can't play there, for example. You can't play at Hunters Field. People don't send their children under the Claiborne overpass because of the needles, because of the drugs. And, you know, this is not criminalizing someone to say that that's a reality, that there's a lot of drug addiction and abuse in encampments and in areas where people are homeless. But this presents yet another opportunity for us to maybe look beyond the funding and just get it done so that we can do a little bit better in terms of having more points of pickup and, you know, just getting it done as soon as possible. I recently walked a homeless encampment and there are needles that have blood in them, you know, and all over the place. And not everybody there has shoes, for example, that don't, you know, that have complete bottoms, so people get stuck. But you know, I just wanted to mention that to you. I certainly am saddened in some respects by the extent to which drug addiction affects our community. 500 people. People don't even understand that when I said that. And I know too, last year, young people. So, I mean, it's a serious problem. I know that we do everything that we can and in the health department. I appreciate the work of especially people who go unsung like Taylor, you know, getting that kind of work done. And the example that I used on the radio today of the health department working with someone who was unhoused, who was living on a narrow neutral ground on Gentilly Boulevard across from Baptist Theological Seminary, could have rolled out into the traffic at any time. But the health department, the police department, and also DePaul worked. And now she's in a much better state and condition. So, but unfortunately, that has to happen a lot. But I digress. The most important thing is this is about opioid addiction, the effect that it has on our community. And let's get the word out to people that there are resources that can be made available to them. And they just, if they can find a way to somehow get to them.
Right.
Thank you.
All right. So with that, I will move for approval, seconded by Councilmember Moreno. Seeing no opposition. Yeah, 4 yeas, no nays. Thank you very much. We'll advance this to council for Thursday. I
All right, I think that completes our meeting. So Councilmember Green, do you have a motion?
So moved.
All
Adjourn.
right, a motion to adjourn by Councilmember Green, seconded by Councilmember Harris. All in favor? Aye, we are
Aye.
adjourned.